Hi, Assalamu alaikum and good morning everyone. Thank you for visiting my channel again. Abdurrahim here with you. So we are continuing our aortic stenosis topic, and today we are going to learn a very important aspect of aortic stenosis. As I told you in the last vlog that sometimes we can have discrepancies between our findings and also the gradient of the aortic stenosis. Like for example, some of our parameters, for example, gradients are suggesting that this is moderate or mild aortic stenosis, but our valve area is suggesting that this is severe aortic stenosis. So what we should do in this particular situation, in these days in the echo lab, we are encountering these patients many times. Okay, so how you are going to report those patients, or how you are going to figure out whether this aortic stenosis is severe or not severe. So this is very important to learn. If we talk about the guidelines, American and European guidelines are almost the same in this particular situation. British guidelines are slightly different than that, but if you go into the detail, the concept of all the guidelines is almost very same. Okay, so I will tell you that if you are working in an echo lab where they are following the British or American guidelines, how you should approach these patients, and if you are working in a British certified echo lab, how you should approach these patients. Okay, first I will tell you about the European guidelines. So in the European guidelines, you can have two types of stenosis. Okay, one is a high flow, high gradient aortic stenosis, and one is a low flow, low gradient aortic stenosis. So first I will go towards the high flow. So this is an easy one. So for example, you look at the aortic valve looks calcified and there is restricted opening. You get the gradients are high, very high gradients, and you get that this is a quite severe aortic stenosis. But in that patient, you need to look for the high flow state. If the patient's stroke volume is also very high, so you need to exclude these conditions. Okay, if the if there are no conditions which are causing high stroke volume, then it's a severe aortic stenosis. But if there are conditions, for example, anemia, hyperthyroidism, or any arteriovenous shunts which are causing high gradients or high stroke volume, and that high stroke volume could be a cause of high gradients, so then you need to look for that whether these conditions are reversible or not reversible. If they are not reversible, this is severe aortic stenosis. If they are reversible, you need to reverse them and to see how is and to reassess everything again. So this is your high flow, high gradient aortic stenosis. So let's come to the other part which we usually see more. Okay, so these are the category I'm going to tell you now. These are the patients we almost see in everyday routine. So what happens is that, like for example, we get the mean gradient suggesting that this is not severe aortic stenosis, which is around less than 40 millimeter mercury. We are having a peak velocity of less than 4, again not suggesting severe aortic stenosis, but we are having a valve area of less than 1, which is suggesting severe aortic stenosis. So now we have a discrepancy between our findings, between our parameters. Gradients are suggesting that this is a moderate aortic stenosis or maybe mild aortic stenosis, but our valve area is suggesting that this is severe aortic stenosis. So in these patients, the first thing you need to assess is your measurements. Try to exclude measurement errors. Mainly look at your like how you get the Doppler. If you try to use the PDAF probe to get the higher gradients, okay, and then also look at your LVOT diameter. Especially these patients are very elderly patients, and you are having calcified valves, so measuring the LVOT could be very challenging. So you always need to keep in mind that you need to exclude the calcification to get a good LVOT diameter, to get a proper LVOT diameter. Then you need to also check that where you are putting your LVOT VTI cursor, okay, and how you are measuring your LVOT VTI. So you need to look at everything very carefully. Okay, so once you check everything, but still you see like there is a discrepancy, that the gradients are in moderate range, but your valve area is severe. So now what you need to do, you need to look for the stroke volume first. Okay, so you need to calculate the LVOT stroke volume. There is a number like 35 ml per meter square. Okay, it's an index number, so 35 index stroke volume. If the stroke volume is less than 35 ml per meter square, it means the patient is in low flow state. Okay, so and if your stroke volume is more than 35, it means the stroke volume is normal. So first we will go towards the normal stroke volume. So if a patient is having a stroke volume of more than 35, okay, and mean gradient of less than 40 and valve area less than 1, so in this patient, the guidelines say that aortic stenosis is likely not to be severe and should be reported as moderate range. Okay. Now we come to the other way, which is the stroke volume less than 35. Okay. Once your stroke volume is less than 35, the next thing you need to look is the LVEF. So if your LVEF is less than 50%, it's going to be a different thing, and if it's more than 50%, it's going to be a different way. So first we'll go towards the more than 50%. So if your LVEF is more than 50%, which is a preserved LVEF, so a patient with preserved LVEF with low stroke volume and also with low gradients and also with the severe valve area, these patients are usually, you can't do anything with these patients in echo, so you need to send the patient to either CT scan, like multimodality imaging. Okay, let's come to the other side. Now your LVEF is less than 50%, your mean gradient is less than 40 millimeter mercury, and your valve area is also less than 1. So these patients are classical low flow, low gradient aortic stenosis. Okay, so these patients, you need to send them for debutamine stress echo, and in debutamine stress echo you will come to know that whether this is a true severe aortic stenosis or pseudo severe aortic stenosis. Okay, so I will make a full vlog on the debutamine stress echo in aortic stenosis patient, that how you will describe that this is a true severe or this is pseudo severe aortic stenosis. Okay, by the way, a patient who is having normal EF with the low stroke volume, you will call it paradoxical low flow, low gradient aortic stenosis, and you can't do much about that one. Okay, so this was mainly from the European guidelines, and also Americans follow the same. Okay, so now let's come to the British side of it. Okay, so let's come to the British guidelines. If you're working in an echo lab where they are following British guidelines, so how you're going to describe or report these patients. So first you need to look for the LVEF. If your LVEF is more than 50%, okay, you will call it preserved function. And then in this function, if your parameters are like suggesting, gradients are suggesting moderate aortic stenosis, like less than 40 mean gradient, less than 4 your peak velocity, but your valve area is less than 1 and your valve area index is less than 0.6, it means you are in this range. Okay, so it means there is a discrepancy between your parameters. So what you need to do in this case, you need to distinguish how is your stroke volume. So first thing, remember that you need to exclude your measurements errors. Okay, I told you in the, earlier in the vlog. So you need to exclude the errors, then you need to get your stroke volume. If your stroke volume is more than 35, it means the severe AS is unlikely, so leave it there. Okay, next you come to the other side with when your stroke volume is less than 35. If your stroke volume is less than 35, okay, then there are some points you need to look at. If your mean gradient is more than 30 to 35, like more than 30, you consider it severe aortic stenosis. If your mean gradient is less than 25, it means it's not a severe aortic stenosis, it could be moderate aortic stenosis. Okay, if your valve area is less than 0.8, it means it could be a severe aortic stenosis. So this is another point. So you need to look at these points. You can see it on the screen as well. Now let's come to the other side where your LVEF is less than 40. Okay, in European it was less than 50. Here it's less than 40%. Okay, so if your LVEF is less than 40% and you are having the same findings, mean gradient less than 40, peak velocity less than 4, valve area less than 1, valve area index less than 0.6, it means you are again in the gray scale. So this is called the reduced EF, and these patients you should send to the debutamine stress echo to exclude whether this is a true severe aortic stenosis or maybe a pseudo severe aortic stenosis. Okay, and you will report it as a classical low flow, low gradient aortic stenosis, and you should say that debutamine stress echo should be considered. Okay, the same as you did it in the European one. Okay, so now there is a gray zone between. Okay, like from LVEF 40 to 50. There are no clear guidelines in British about this one. So in European, if you are having less than 50%, you are sending them to the debutamine stress echo. Here, if your LVEF is near, like close to 40%, okay, and your mean gradients are touching like 30-35, okay, that you should send these patients to the vitamin stress echo, and you might get help from there. Okay, it can be, it can be helpful. Okay, and in the patients who are having LVEF closer to 50%, okay, and then their mean gradient is less than 40%, less than 40 or close to 40, then the vitamin stress echo is not going to be very much helpful in these patients. Okay, this was very complicated. I hope I translated everything in a proper way, but if I did some mistakes, please feel free to write there and try to understand it better. If you have any questions, please feel free to ask. Okay, thank you very much, and I'll see you in the next vlog soon. Bye bye.